my front porch. Okay. So yesterday, just to kind of review, the hypothalamus, which is part of the diencephalon, which is in the brain, is controls the action of the pituitary gland. The pituitary gland is linked to the hypothalamus, does have these special neurons, and the hypothalamus controls the activity of the pituitary gland, but the pituitary is considered the master endocrine gland. So it does all the work, even though it's being controlled by the hypothalamus. So basically, the hypothalamus is monitoring all these body functions to keep everything in homeostasis. And based on feedback from the body, it can control hormones that it wishes to release. Now, the pituitary gland has two portions. It looks like one structure, but it has an anterior and a posterior pituitary. Now, the anterior pituitary produces all of these hormones. It produces them and releases them when it's told to. Now, remember, there's a releasing factor and an inhibiting factor. So if the hypothalamus wants something done, or we need positive feedback, it sends a releasing factor to the pituitary, and then the pituitary is going to release one of these hormones to cause an effect. And then by monitoring feedback, if something was achieved, the hypothalamus can send a inhibiting factor, which will stop the release, which that's the negative feedback, and then it will stop the release. But let me talk about, these are the hormones produced by the anterior, which is the rostral part, closer to the nose, of the pituitary. And we're going to go through each of these. Sorry. Okay. So growth hormone is pretty self-explanatory. It's also known as somatotropin or somatotropic. If you break down that word, soma is body, tropic means growth. So body growth or growth hormone. And this helps regulate metabolism. So this hormone does have an effect kind of on the whole body, because we're talking about the growth of the body. So it regulates metabolism of your proteins, lipids, and your carbs in the body. Now, it can encourage anabolism, or, creating of proteins. It can also release storage. Whenever we talk about catabolism is when something is stored within the body and the body is going to break down that store to access. So if you remember, fat is stored energy. If we need to increase metabolism, we need to increase energy. So it can catabolize fat, and it can mobilize energy if need be for cellular function, body function. It can also discourage cells from using carbohydrates and glucose. So now, growth hormone is obviously going to be more active when the animal is younger, when they're growing. It's also going to be more active for a longer period of time in a larger breed, because obviously, most big dogs, large breeds, don't reach skeletal or body maturity until they're about 2 years of age. So again, and then growth hormone does start to drop off as they age, which sometimes older animals start to lose fat, start to lose muscle mass. And so as you age, this hormone starts to decrease in production. But it's pretty much, I want you to know, body growth hormone helps regulate metabolism. But metabolism is, encouraging growth, encouraging use of nutrition and stores to maintain body development. Now, prolactin, if we look at the name, prolactin, lactation, this hormone will trigger and maintain lactation. Now, we are going to talk about lactation in the next week, because we're going to talk about reproduction and lactation and pregnancy. But basically, when an animal becomes pregnant and they start to develop mammary tissue, now, when the animal is born, if they are allowed to nurse off of the mother, then the young are stimulating the teat, and basically they're emptying the teat of milk. As long as there is stimulus at the teat, prolactin is going to continue to be released to maintain the mammary gland or to maintain milk production. Now, when we talk about weaning, oh, go ahead, Catherine.
So I have a cat and I got him when he was a kitten. My roommate also has a cat. So when we moved in together, his cat had just been spayed, but we think that she had a litter before. So my kitten ended up trying to nurse from his cat, and she actually started producing milk, even though she obviously he wasn't her kitten. Is that because it was stimulating that hormone?
Probably. So if there was some mammary development already there, and then your cat, was nursing, even though that cat's not your cat, didn't come from that cat, but that active stimulation could cause release. Now, if your cat just went up to any cat that didn't have mammary development, I mean, it would be rare that that act would cause, but maybe because there was some existing mammary development, it will cause release and will cause, it will cause that gland to continue to be developed and continue to produce milk. Um, if I think about puppies, and kittens are similar, but I'll talk about puppies. Um, when typically when they're born, puppies stay nursing for about 4 weeks. And around 4 weeks, usually people will start to get will start to feed the puppy gruel, which is basically maybe canned food or dry food that's been soaked in milk or water. In gruel, it's kind of like, again, it's not strictly canned food, but it's kind of mixed, and it's kind of liquidy. And then the puppies will start eating this gruel. Now, the fact that the gruel keeps them full longer, they typically will nurse less. So it's basically, you're kind of starting to wean the puppies. Now the fact that they're still nursing, the mother's going to still have mammary development, but about week 6 to 8, usually around week 6, puppies are almost transitioned to complete like puppy food, maybe gruel mixed with some like dry food. I got AJ at six weeks old. He was already crunching on little puppy food, so even though he's got little baby teeth, he was already, I obviously have him, so he doesn't have the mother, but I was moistening it with water, but I would give him like a handful of dry. He was already eating. But so what's going to happen around 6 to 8 weeks is when those puppies are what we say fully weaned, or they're brought off the mother, there's no longer stimulus at the teat. And it's going to stop milk production. And this is called drying them up. The mammary gland eventually should go back to normal size. It should shrink. Now, there could be a couple days where she's a little uncomfortable, because sometimes when, the goal with weaning is to slowly wean them so the gland starts to make less and less milk. If you just have if you have a puppy that's nursing exclusively and that puppy's taken away abruptly, there can be a very swollen, uncomfortable gland. And eventually, though, what's going to happen is the milk that's in that gland, the body will reabsorb, the gland will shrink, and sometimes we have to dry them up. So if we use that slang term, we're basically weaning, or we're drying up the gland. Yes, and I, as Rachel, if you have kids, and maybe TMI, I had 2 kids, and I did breastfeed. But luckily, both of my kids, at around 10 months old, they were starting to eat cereal and drink juice, and they were not nursing as often. And then eventually, at a year old, both of them just completely transitioned to cereal and a sippy cup. And then, so for women that are going to have kids, you go back to normal. But yes, there is an uncomfortable phase where, your body is kind of still making it, but that's why we try to not do an abrupt, like 100% nursing and then completely transition to something else in people and in animals. Now, what happens in cows, so when you have dairy cattle, they have a calf, and typically what happens is the calf is removed from the mother, and the calf is bottle fed for a period of time. But then the mother, she has full mammary glands, and they're typically milked twice a day, usually on a machine. And that machine is completely draining the mammary gland. And obviously, if it's being stimulated and drained, it's going to fill up again. And, then you're going to have a dairy cow. Now, they also use hormones to mimic, because, when you get out to about a year, it becomes a little unnatural that the gland is still making this much milk, but they can kind of mimic cycles and hormones. And I won't get into all that. You'll probably talk about that a little more in large animal, but that's what happens in cattle or in cows. You have dairy cows, they're milked twice a day, the gland is evacuated, it fills right back up, and there's a constant stimulation. So prolactin, as long as the teat is being stimulated, the pituitary gland, well, the hypothalamus detects that the gland is empty, sends prolactin is released. So prolactin's target is the mammary gland. Prolactin isn't gonna, it's going to the mammary gland, and that's its job, and it's to maintain lactation. But to continue to release prolactin, there has to be stimulus at the teat. If there's no stimulus, there's no stimulus, there's no need for prolactin. There you go. Now, the next one is pretty self-explanatory, but let me talk about thyroid stimulating hormone. Now, thyroid stimulating hormone is known as TSH, and it also goes by thyrotropic, which is thyroid, and tropic is growth. So part of what TSH does is it maintains the growth and development of the thyroid gland. Now, the thyroid gland is in the neck. It's right near, it's just ventral to the larynx. So where the larynx is, they have a thyroid. And we're going to talk about the thyroid gland coming up. But so TSH is released from the pituitary to maintain the growth of the thyroid gland. Now, what is the stimulus for this? Well, it monitors the size and development of the thyroid gland by getting feedback from the thyroid. Also, there's an interaction between the hypothalamus, pituitary, and the thyroid gland. But basically, the levels of circulating active thyroid hormone are going to give feedback to, does this need to be developed? But so the target of TSH is the thyroid gland. Now, I do stress the thyroid gland with you guys because, a fair amount of animals come into the clinic to be assessed for thyroid disease. There's two forms. There's hypothyroid and hyperthyroid. But when we do what's called a thyroid panel, we evaluate all aspects of the thyroid. We look at the thyroid hormones, but we also measure TSH, because if an animal was having thyroid issues, is it an issue with the actual thyroid gland in the neck, or is it an issue with TSH? So by evaluating, doing what's called an initial thyroid panel, there's two sides to the equation. And so we have to kind of figure out what's the origination of the thyroid problem? Is it in the thyroid gland, or is it an issue with TSH? But that's the target, maintaining the growth and development, also helping maintain release of thyroid hormones. Now, this one, which is abbreviated ACTH, adrenocorticotropic hormone, and this is the one I mentioned yesterday. Adreno is for adrenal gland, cort is for adrenal cortex, tropic is growth. So adrenocorticotropic hormone, or ACTH, stimulates growth and development of the adrenal cortex. So I'm going to talk again. This is released from the pituitary. Its target is going to be the adrenal cortex. And I'm going to talk about the adrenal gland later. But its stimulus to be released is based off of feedback in the body from the adrenal cortex. Now, the adrenal gland, and that's coming up, is really maintains the body's stress response. If you guys remember when I talked about the nervous system and I talked about fight and flight and I talked about cortisol, cortisol is the primary hormone of stress, comes from the adrenal cortex. Cortisol, cortex, you see the connection. But the animal needs a functioning adrenal gland to appropriately respond to stress, which is fight and flight. Now, if you look at your dog and you think, what's stressful about your life? Like my dogs are laying on blankets right now and get treats. But when somebody rings that doorbell, they go psycho ballistic. If something they think is in the yard, they go ballistic. Those are stressful events. And those events put a lot of stress on the body. They use a lot of stores. Blood pressure goes up, heart rate goes up, breathing more often, using glucose, using stores. So the body's ability to respond to what's stressful to a dog is maintained by this gland. Now, again, if an animal has adrenal issues, that is rooted in, do you have a functioning adrenal gland and the ability to respond? But again, ACTH is what is what helps develop and maintain, hopefully to maintain a healthy, active adrenal gland. But again, that's in the name. Luckily, a lot of these names are making sense and the names are quite explanatory. The other one that's released from the pituitary is FSH, which is follicle stimulating hormone. Now, this name comes from the effect it has on females. If you think about the ovarian follicle, this is what I'm going to be talking. And again, this I'm also going to talk about when we do the reproductive system. So, this will make sense. I'll get into this a little more in depth in reproduction. But in the female, the job of FSH is to stimulate oogenesis, which is development of the egg or the ovum. Egg, genesis, creation of, right? So inside the ovary, there's an oocyte, which is basically a cell that can be developed to turn into an egg. And then remember, we talk about the reproductive cycle. When they cycle or go into heat and an egg is released, and that can get fertilized, and then pregnancy occurs. So the beginning of that whole process is started by FSH. And then FSH in turn stimulates production and secretion of estrogen, because now estrogen is produced and released from the ovary, but the stimulus to begin the production and release is started by FSH. So when it's time for an egg to be developed, FSH is going to be released from the pituitary. Its target is going to be the ovary. And when it stimulates the ovarian follicle stimulating hormone, that follicle is stimulated, it's going to start to produce and release estrogen. Okay, so there's always a connection from the pituitary to a target and what's its job. And again, I'm going to be talking about estrogen in a little bit. I'm just talking about this part first. Now, follicle stimulating hormone does have an effect in the male, even though it's named for what it does in the female, because a male doesn't have a follicle per se. But in the male, it's going to stimulate spermatogenesis, and that's the creation of sperm. So in a male, FSH is released. Its target is going to be the testicular tissue, because that's where the spermatozoa or the spermatocyte or a cell is, when it's released, it's going to initiate the development of a spermatocyte into a mature spermatozoa. Okay, so both male and female, it has a reproductive role. In the female, it's stimulating production of the egg, which is the ovum, and then in the male, it's going to create or begin the process of mature sperm, or to produce, spermatogenesis. And again, genesis is creation of, so beginning that production. Now, on the other side, there's something called luteinizing hormone, and this again will make more sense in reproduction. But luteinizing hormone is what finishes the follicle development in the ovary. Okay, so let me talk about in the ovary, basically what happens when the oocyte is, when the follicle is stimulated, an oocyte is going to be stimulated to produce an egg or an ovum, but it is enclosed in a follicle. Now, inside that follicle, that egg is going to grow. Now, and estrogen is going to grow with the egg. But when the follicle is growing, luteinizing hormone is going to start to go as well. It's going to be released. When the egg is mature, luteinizing hormone is going to cause the release of that egg, which is ovulation. So when an animal ovulates, the egg is ready and it's released, and then that animal can be bred to potentially become pregnant. But you have to have ovulation first, so the egg is released. Now, I try to give you guys little tips to remember things. Luteinizing release, lease. I don't know if that makes sense to you, but luteinizing releasing the ovum, and that is ovulation. And then something called a corpus luteum is going to develop. Now, again, inside the ovary, there was a follicle. When the egg gets released, this follicle becomes like an empty sac inside the ovary. And when that seals, it becomes like an empty sac, but it's a corpus luteum. Now the egg is gone, but what happens is that corpus luteum is going to produce its own hormones that I'm going to talk about. So I want you to know a corpus luteum, it's found in the ovary, but after the follicle releases the ovum and it's empty, it seals off and becomes a corpus luteum. And then I'll talk about its job coming up. In the male, they have luteinizing hormone, but its job is to stimulate cells called interstitial cells in the testicles to produce testosterone. So in the male, that's the primary sex hormone in the male. So estrogen is the primary sex hormone in the female. Testosterone is the primary sex hormone in the male. And testosterone is made in the testicles. Hence, when we neuter, testosterone gives them their feelings of bravado, and sometimes dogs are a little bullheaded. I mean, I have one intact now, and sometimes, I think it's time to snip, snip. And that's why when we neuter them, we take away that testosterone. A lot of times they calm down and they're not so roaming and things like that. So luteinizing hormone has an effect in the male and the female. I always think of it primarily in the female, but it does have a role in the male. Now, you don't need to know for the test. I'll just briefly, melanocyte stimulating hormone, which, if you remember, your melanocytes are your pigment cells. Now, a melanocyte produces melanin granules, and the melanin is what gives pigment. But in animals that have color change, so certain reptiles and certain fish that can change color, the hormones can control the color change, and that's what melanocyte stimulating hormone does. If we gave this to an animal, you could cause darkening of the skin. But again, I want you to focus on the other hormones. I'm not going to put this one on the test. Now, I have to talk about the other two hormones. So everything I just talked about is made and released in the anterior pituitary. But if you remember, there's a posterior pituitary. And you don't need to know neurohypophysis. I just want you to know the posterior pituitary. But remember, the posterior pituitary is just for storage. It doesn't produce hormones. It stores ADH, which is antidiuretic hormone, and oxytocin. Now, those two hormones are produced by the hypothalamus. But remember, the hypothalamus is like, hey, I produce them, but I'm going to let you do the dirty work and you release them when I tell you to. So basically, if you remember, the hypothalamus produces these two hormones, sends them to the posterior pituitary. I said it's kind of like your storage closet in the back of the house. So you got your coats are stored. If you need them, you can get them. So when the hypothalamus needs to release these hormones, it's going to send a releasing factor to the posterior pituitary, and then the posterior pituitary releases these. So as long as you know these are just stored and released by the posterior pituitary, they're not produced in the posterior pituitary. Now, again, there are nerve fibers and special nerve endings that connect the hypothalamus to the pituitary. And those signals and hormones can be sent along those nerve fibers. Now, again, the hypothalamus is monitoring something in the body, and then it can cause a release or a stopping of releasing these hormones based on nerve impulses. So again, I've kind of already talked about these, but it's important. So ADH, antidiuretic hormone, prevents diuresis. Now, diuresis is basically getting rid of body water through the urine. Okay. Now, and you guys will hear this when you talk about pharmacology and you talk about drugs, because people, well, and animals can be put on diuretics. If we give an animal a diuretic, we're giving them a drug that's forcing body water to leave through the kidney, or it's increasing the release of body water. So sometimes we do it when animals have heart failure. A lot of animals with heart failure are on diuretics. Furosemide or Lasix is the main one that comes to mind. Sometimes animals that have edema or their swollen tissues, sometimes they are put on a diuretic to pull the water out of the tissues and force it out the kidney. Anytime an animal's on a diuretic, I always tell the owner they may want to drink more, they're going to urinate more, because we're forcing more body water out of the kidney pharmacologically. Now, ADH, its job is to maintain normal hydration status in the body. So when the hypothalamus is monitoring hydration, and remember, I told you guys, this isn't clinical dehydration, okay? The body, the hypothalamus is monitoring minute levels of dehydration. But if they detect any level of dehydration, the hypothalamus will send a releasing factor to the posterior pituitary. ADH is released. Its target is the kidney. And what it will do, it will tell the kidney, instead of excreting that body water into urine, it'll cause reabsorption of body water into the blood vessels to reestablish hydration. So typically, ADH is released in the face of dehydration to hopefully improve hydration. Now, you can have, I'm going to be talking, I always talk about a few disorders because I think it helps you understand normal from abnormal. But if an animal is ADH deficient, say they're deficient, say the hypothalamus isn't producing ADH, or the body's not releasing appropriate levels of ADH, then this can cause a condition called diabetes insipidus. I don't want you to get this confused with the common thing we think about. Diabetes mellitus is when the animal isn't producing insulin and they have like elevated blood glucose. When an animal has diabetes insipidus, it typically comes from this pituitary issue. They're deficient in ADH, and the animals become polyuric and polydipsic. Now remember, they're polyuric first because the body is just urinating and urinating, not regulating water levels. Therefore, they're polydipsic. The polyuria drives the polydipsia. This isn't super common, but we did see a cat when I was doing radiation. They diagnosed a cat with a pituitary tumor. They did an MRI. These people love this cat more than life itself. But the cat, in the history, the neurology department did an MRI. They found a tumor in the pituitary gland. and the owners wanted to pursue radiation because this area, we do brain surgery at VCA. It's quite interesting, but radiation, we were hoping to shrink the tumor to improve the condition of the cat because it was in an area that they couldn't operate. When I would do radiation on this cat would wake up and it would literally lay its head in its water bowl. And I feel like the whole time I was at the hospital, just lick, lick, lick. Like this cat could not get enough water. I mean, it would put its head up and it'd be like dripping water. I was constantly like drying it off. And the lady sent a special comforter. And then unfortunately, I'd sometimes move the cat and it had urinated. And it was very dilute, watery urine because the cat's polyuric and polydipsic. And I just remember this case because, I hadn't, seen a cat with this in quite a while. And, and a couple of times I'd walk by the cage because I took the water bowl because I'm like, I feel like the cat was just going to put its head in the water and drown itself because I'm like, it just lays in its water bowl. I'm like, what if you fall asleep in your water, dude? Like, but it was literally from the tumor in this area was making the cat. And this was one of the first clinical signs that the owners reported. My cat is literally like laying in the water bowl, drinking all the time, peeing itself. And it's because of this tumor. And, we got about 3/4 of the way through treatment. Brain radiation is 16 radiations, but the cat started having some other issues and they didn't finish treatment. I think they eventually euthanized, unfortunately. But sorry, I don't always like to tell you guys sad stuff. But that case, it was very classic, like pituitary issue, drinking, urinating all the time, and it all made sense. Now, let me talk about oxytocin. Oxytocin has its effect on the uterus. So its target is the uterus. Now, what happens is oxytocin's job is to induce uterine contractions and basically initiates birth. So basically, when the uterus begins to contract, they're going to expel the fetus or give birth. And that's what parturition is the act of giving birth. So oxytocin initiates this process. It also does have an effect on the mammary glands. So when the animal is nursing, when the animal first latches and begins to nurse, there's something called milk letdown. Now, I'm going to get into the mammary gland when we do reproduction, but up in the gland are like sinuses, basically alveoli, different from the lungs, but sacs that produce the milk. But the milk is high up in the gland. When the animal begins to nurse or, stimulate the teat, we have to let the milk let down, where it moves into the lower part of the mammary gland where they can actually begin to nurse. So oxytocin, now prolactin develops the teat, develops the gland, and maintains the production of milk. Oxytocin allows the milk to move into the lower teat and the animal can actually nurse. So both of these hormones need the teat to be stimulated to be produced. Now, when the hypothalamus is very smart. When the fetus grows and the body detects fetal size and weight, the hypothalamus will release oxytocin because it detects that the fetus is ready to be born. Now, every animal has what we call a gestation period. Dogs and cats, gestation is about 62 to 64 days, meaning from the day they get pregnant or from the day they get the day the egg is fertilized till they give birth is around 2 months. But as that fetus is growing and growing and growing, the hypothalamus will detect hormone levels and weight of the fetus. It will release oxytocin. Oxytocin will go to the uterus and will initiate those muscle contractions, and then the fetus is born. Now, if you've worked in a clinic, or if you've been in emergency, or maybe you've heard of this, there is a drug form of oxytocin. So when, on emergency, sometimes we get a call and someone says, my dog is pushing, trying to give birth, no fetus is coming out. And now the first thing that we usually do is, first of all, the dog's got to come in. We have to confirm that there's not a fetus stuck. If there's a fetus that's stuck in the birth canal, then we usually have to do a C-section. But sometimes, the mother might just not be healthy. Maybe the mother is malnourished, or maybe the mother is exhausted, like she's been pushing and pushing. When we will give oxytocin IV to initiate a stronger uterine contraction, and maybe with a little bit of help, then she can push out the pup. But you can't do that if the pup is stuck, because then the uterus is contracting. But if it's a stuck puppy, that's a different story. So you don't give this in every situation where an animal can't produce offspring. You have to kind of figure out why they're not giving birth. But oxytocin can be used to initiate, and you may have heard it. I was just about to say, in people, you probably have heard about Pitocin, which is the same drug family. Pitocin will induce labor in people. I have not needed Pitocin, thank the Lord, but friends of mine, if they've been induced, if they induce labor, they give Pitocin. I didn't know it smelled bad though. But same family, same principle. But again, if for some reason there was difficulty giving birth, I think about, like, there's some breeds, like I think about English bulldogs and Frenchies. Unfortunately, and sometimes Chihuahuas. Sometimes those dogs, their narrow birth canal, their pelvis, their anatomy, and the head of the fetus is too big. And those dogs just traditionally need C-sections. We're not going to give a dog like that oxytocin because it's a stuck issue. So early or late births, now sometimes that's a little more complicated. It can be, early births, I don't know if you're talking about in people, because, you do your best to say, this is the day we think pregnancy occurred. And then your doctor says your due date is here. But, if the baby gets bigger earlier and then the body detects it, or sometimes it's an abnormal, like if babies are really, really premature, there can be, where the natural oxytocin is released too early and causes that birth. So it could be that, there's a dysfunction in oxytocin. It was released too early, because once uterine contractions begin, and maybe, Steffi, I know you have a medical background. I don't know if you can give drugs to stop labor, but sometimes it's just going to happen. So not that you have to answer, but so they're available to only slow it down. Yeah. And late births, it can, like I said, anytime something is supposed to happen normally, there could be an off balance with oxytocin where it wasn't released in time, and then someone has to be induced. Now, we can, most of the time when I've been on emergency and we've done oxytocin, the animal was actively trying and needed help. It wasn't like, oh my gosh, she was supposed to have puppies last week, let's give her oxytocin, So yeah, there's probably a lot more to that, Catherine. I know maybe I'm not answering that well, but it can be just an off balance with something in this situation. Okay. So let me now talk about, and I will tell you something like Rachel's saying here, if there's like a cutoff where if you're at this many weeks, we have to induce labor. If we have an animal, like say they came in and they said, my dog was supposed to give birth last week, one of the first things we're going to do is, hopefully if we have ultrasound, is we can check for the viability, because unfortunately, if for some reason the fetus had died internally, And, then sometimes there's no stimulus to initiate a contraction. Now, we probably, in that situation in veterinary medicine, we usually remove them via C-section. In people, they may induce labor and unfortunately pass a baby that is not viable. But in our situation, we would probably just go ahead and do a C-section. Um, and there's lots of factors, patient factors, health, and things like that. So let me mention the thyroid gland. So now I'm talking about the glands. I kind of call them satellite glands. So everything I just talked about is in the pituitary up here. But now, where are the glands in the body, out in the body, and what are their jobs? So the first one I think about is the thyroid gland. And the thyroid gland, again, I told you it's part of the larynx. It's very, very tiny. It looks like a butterfly gland. Actually, let me see if I can, whenever I try to do this, like computer be nice. I don't want to lose my mouse again. Okay, hopefully you guys can see this okay. Okay, I know I'm going to try to bring up a bigger picture, but this is the thyroid. So here's a cat in ventral, or, in VD, and here's the larynx and here's the trachea. And usually right near the larynx, just ventral, it's a paired gland. So here, again, larynx, trachea, a gland. Now it's showing you in this picture, one side of the gland is enlarged. Here's in like a surgical view. So here are the glands, and they almost look flat. It's not like very round. They're kind of a little bit elongated, flat up against the trachea. And so when we look at this, let me see if I can. Now this might be, if we're lucky during dissection, you might be able to find it. It's hard to see that they're kind of, let's see if I can get a better picture. These aren't the greatest. They're very hard to see during dissection. A couple times we have found them. Here's a trachea. Here's showing you what it looks like. So maybe this is only showing you one side, but here's where the thyroid gland would be. And I think the drawings are a little bit better. So you have a right and a left thyroid, and they have this thing called an isthmus, which is a band of, and I didn't slur, is a band of tissue that connects the two sides of the glands. They should be the same size. So they should be something, we use a term we call as bilaterally symmetrical. Means bilateral, both sides are the same size. Now, if we want to check, here's a lovely little hyperthyroid cat. I should show you old pictures. In a cat, so my cat, let me talk off the cuff. My cat used to be like 20 pounds. I mean, this cat died now over this last summer, but she had been very plump and she started to lose weight. And my husband was like, very non-medical person. He's like, hey, look at her. She's losing weight. And I said, I've not cut back her food and I've not put her on a kitty treadmill. So I don't like the fact that she's losing weight because I'm not doing anything differently from when she weighed 20 pounds. And she was starving. At first when she lost weight, she's losing weight in the face of hunger. It wasn't like she was not eating and losing weight. She was losing weight and she was eating like crazy. This cat would jump up and steal, like she grabbed the whole like piece of chicken, like KFC, like grabbed it, growled. She eat a whole chicken nugget. She would steal like she put her paw up on my husband's plate, pulled off a sandwich. I mean, she was crazy. We called her Savage towards the end. My kids gave her that nickname. They're like, oh, Savage is here. Because I'm like, guard your plate. But what was happening is when I felt her neck, I could feel a bump just under her larynx. And I could feel it was almost bulbous. One side was bigger than the other. So I was like, her thyroid's enlarged. Because normally in a cat, you shouldn't feel it. If you reach in and feel their trachea and you slide back and forth, if you go right under the rigid structure, you should just feel like the bumps of the trachea. But I could feel something swollen. And then her blood work confirmed that she was hyperthyroid. And hyperthyroid cats, they tend to look, again, very kind of, if you look at, no, why is this not going anywhere? Ah, there we go. They tend to look very skinny, very unkempt. Sometimes they overgroom. They're very on edge. Like she was always like very grouchy and very like hyper, super high heart rate, starving all the time. I mean, these are very classic symptoms of hyperthyroid. And you can pretty much look at a cat and be like, I think you're hyperthyroid. Now, renal disease can cause weight loss, but the difference in renal disease is they're losing weight, but they're also not eating because they don't feel good. So in hyperthyroidism, she's losing weight, but she's eating like crazy. So I just started feeding her whatever she wanted. I was just like, you can try to fatten them up, but it's a little bit difficult. So let me get back to our PowerPoint here. So the lobes can be connected. They're on either side of the larynx. But what they do is they produce thyroid hormone and calcitonin. Now, the thyroid hormones that they do make, there's tetraiodothyronine and triiodothyronine. I just want you to know them as T3 and T4. So the thyroid gland, again, TSH is released from the pituitary to stimulate or maintain growth of the thyroid, but the thyroid gland itself produces T3 and T4. And these are the circulating hormones. So T3 is known as the active hormone. T4 is kind of like a pro-hormone, and they work together. But what I want you to do, or want you to know, is they are produced and released when TSH stimulates the thyroid gland. So TSH is hypothalamus, sends a releasing factor. TSH goes to the thyroid gland releases T3 and T4. Now, what are thyroid hormones responsible for? They basically regulate the metabolic rate of all of the cells. So thyroid hormone kind of has an effect on the whole body. So when I say what is the job of thyroid hormone, it's regulating metabolic rate. It also has a calorigenic effect. So it can mobilize calories for use for energy and metabolism. And it affects metabolism of proteins, carbs, and lipids. It will anabolize or create proteins. It maintains homeostasis of blood glucose, but it also encourages catabolism of lipids. Now, what did I just tell you about my cat? My cat was like 20 pounds. Like, yeah, she was overweight and she was a big kitty. And then all of a sudden she's 14 pounds, encouraging catabolism, breakdown of her fat. Now, what happened when she lost her fat, she also eventually started losing muscle because I tried to treat her. She wasn't responding to the meds. She was also an awful cat to deal with medically, like to get, blood tests. So I tried different medications. So eventually, unfortunately, she ended up passing, but she wasn't a good treatment kitty. There's options for treating, ClinMed 3 goes over endocrine disorders. We'll get into this a little more in depth. But because of the calorigenic effect, these animals lose weight that are hyperthyroid. Now I don't want to neglect hypothyroid. I had a golden that was hypothyroid. Now in that situation, what happened was my golden was super lazy, was overweight, would always lay on the heating registers. One thing animals with thyroid issues, we call them heat seekers. These animals have a tendency to lay on heating registers in the floor because part of regulating metabolic rate is regulating body temperature. And they don't have the ability to do that as well. So they seek heat. So again, now my cat, occasionally I would find her curled up right on a heating vent. My dog in the summer would completely, now is a big lazy golden, would completely lay on the air conditioning vent. But so, you might see them do both. But, so these are just some things. Now, the fact that she was lazy and she was overweight, hair coat, and so she had issues and had to go on thyroid. So you can have, I will tell you in general, dogs tend to be hypothyroid and cats tend to be hyperthyroid. You can see a hypothyroid cat, it's just not as common, and the same as a hyperthyroid dog. So just in general, very common older cats to become hyperthyroid and dogs to become hypothyroid. But this is where we see the weight, the inability to maintain weight, um, the problems with the heat seeking. Now the other hormone I don't want to neglect that the thyroid gland produces is called calcitonin. So it produces T3, T4, which deal with metabolic rate. Now calcitonin sounds probably a lot like calcium. These cells in the thyroid gland, they help maintain blood calcium levels, homeostasis. Remember, you don't want to have hypercalcemia and you don't want to be hypocalcemic. We want to be normocalcemic, normal calcium. This one tends to prevent hypercalcemia. So if elevated calcium levels are detected in the blood, if the hypothalamus detects elevated calcium, it's going to release calcitonin, or it's going to tell the pituitary center releasing factor, release calcitonin, and calcitonin is going to encourage that excess calcium to be deposited in the bones. The body wants to reuse things, recycle. So instead of just excreting calcium, which can happen, it'll tell the bones it'll cause an uptake in calcium. And so it tends to lower, what I want you to know, calcitonin lowers blood calcium levels. So the stimulus for this is to have too low, or you have a high calcium, you need to lower it. I'm going to stop there because I want to talk a little bit about calcitonin and parathyroid hormone because they kind of go together. But do you have any questions? Okay, let me do, I'm going to get the urinary tests graded and look at the names and think about a plan for our final week. And I will let you know